So welcome today. Today I have a special guest, epidemiologist Dr. David Smith. Welcome, Dr. Smith.
Thank you so much, Magda. And I want to thank everyone that is listening to us, and we greatly appreciate you coming to our presentation. I have been asked to talk a few words about viruses, and we are going to give you a little bit of an update on viruses. Viruses are a very interesting topic. My approach to that is I'm a trained physician, and I am at present retired. I had a long career in both academic medicine and in private practice of medicine, around 50 years. And so I stepped away in 2022. And we also did a great deal of research, both in antibiotics and many of the diseases, and got caught up in leading the Kansas City area in response to the HIV epidemic. And we put on the first three or four conferences that were about that. So viruses are very interesting, no matter whether you're oriented toward being someone like I did, who's primarily uh, taking care of patients and advising and giving talks about neuroantibiotics. But almost everyone comes in contact with a virus, and so one of the reasons that they're so difficult to wrap our arms around is the topic is so huge. I mean, there are more viruses than there are stars in the sky. So there's a tremendous number of total viruses. They are what is a virus? Well, as you can see in our slide here, it's a small particle of RNA or the DNA, the building blocks of our cells, and it's surrounded by a protein coating. And they're so small, it's almost a lot of times when you take a look at the different things about viruses, like 150,000 viruses could fit on the head of a pin. And then you're also seeing that viruses can coexist in our body. About 8% of the human genome has viruses that have been integrated into our body. So you can see that we are kind of having this coexistence with viruses. They're part of our body, yet they can cause us severe problems. And over the past 100 years or so, we've seen the big flu epidemic in 1918, 1920. Then we dealt with polio very successfully. They came along, that HIV, which is more certain populations, had a real problem with that. And of course, we recently had the COVID epidemic, which we are still dealing with. And the combination of the isolation of the virus, the preparation of immunization, the understanding which groups are having most of the problem, have made us a whole lot better. I remember one of my professors talked about uh, a quote he made about viruses: "We are what our viruses allow us to be," and that's the way that we have these. Because they say there are trillion of viruses. When I said that, I think the one way to say it there's a billion trillions of viruses that exist throughout the world. Now, what we're mainly want to give you a little bit of our update today is just a snapshot of how an academic and private practice physician takes a look at viruses and some of the ways that we can prevent them and some of the ways that we can treat them and some of the new information that has recently come out. Um, as you see that in the slide, over 200 viruses are pathogenic for man. How do they get into us? We can inhale them, like influenza. They can have physical contact, like herpes. And they're kind of like burglars. They try to break into your home, and they have a key which allows them to attach to a cell and take over that cell and make large copies of themselves. And often when those copies are released, they can destroy the host cell. Yet by the same token, a lot of times they will just sit there for many years and apparently are able to coexist without either multiplying or dying. And we see that with chickenpox, which later shows up at varicella, shingles, excuse me. So I think that's one thing to keep in mind is there's so many ways that the viruses actually do that they can peacefully coexist. So they can be very nasty as far as leading to serious illness and death. Uh, Next slide. Somehow we went away. I'm not sure what happened there.
So you don't see the slide?
I don't see the slide. It just went right away. I see things to help others connect with you. Do you want me to click that? Allow?
Not right.
It says, welcome, David Smith. Uh, Stay contacted. It's in. You want me to just click the top of that to see what happens? Okay. There it came back.
Okay. It
So,
was probably just advertising. Sorry.
no. As far as the modes of transmission of viruses, how they get into our body, we can, as I say, we see them transmit by inhalational, which is influenza, contact with herpes simplex and molluscum contagiosum. They can be sexually transmitted by HIV, herpes simplex type 2, and human papillomavirus. Uh, and that's one of the interesting things. We now have vaccines that can prevent cancer. And that's one of the exciting things because the human papillomavirus is one of the most common things as far as being one of the important causes of cervical cancer. And this may be that we're able to know, number one, immunize all young women for that. And by doing that, I think eventually it may not have to have pap smears as often as has been the custom as we get enough of a population. But we've seen a dramatic 25 to 50% drop in new cases of cervical carcinoma. So I think that's an exciting showing how science can prevent a deadly illness. We can ingestion hepatitis A, a very good vaccine, which has virtually wiped out hepatitis A. Bloodborne hepatitis B and C. This again is we have an excellent vaccine for hep B and very good therapy to treat hepatitis C, which has been dramatic. CMV, cytomegalovirus, is still a real problem, particularly for pregnant ladies who have not had no immunity for CMV. And we saw a lot of cases of CMV in our HIV patients, as you see there. Next slide. So what about, we mentioned a little bit about these initially, but let's talk again. As far as imported viral epidemics of the 20th and 21st century, as you see, the 1918 flu epidemic, huge numbers, 500 million were infected worldwide. Uh, uh, One out of three of those of the world's population seems to have been infected, and 25 to 50 million were killed worldwide. And the number that died in the USA was 670,000, which again is a large number. The next big viral infection that came to everybody's attention was polio. And that certainly continued. And by the mid 20th century, we had eliminated the wild type really since 1979. Only two countries, Pakistan and Afghanistan, still with small numbers. I can remember when I was a captain in the Army, to all Army Depot, and they still had an iron lung there. By the time I went to medical school in the early 60s, the iron lungs were no longer being used, but this one was close by to all Army Depot and the way proving grounds where all the some of the nerve gas was being tested and weaponized. HIV, as I mentioned, still continues to be a big problem. You see in this slide around 90 million infections, about 44 million deaths. And COVID, which has been the new bad actor. Beginning in 2020, given about 760 million cases, 6.9 million deaths, and 13 billion doses of vaccine. So those tell us a little bit about how some of the ones that are the pathogenic or capable of infecting man can be important to us. And so, when we talk about viruses, these are the ones, and fortunately we have good influenza immunization, polio, of course, we've taken care of that. HIV has been a challenge to prevent, but the COVID immunization, although still not quite what we'd like it to be, appears to be very good, or at least in making the individual case less serious. But it is interesting as we think about who will give the COVID vaccine to, trying to immunize all the people over about 65, because that's where the huge percentage of deaths occurred. 80% of the COVID deaths, and that's the funny thing about COVID, is it can be a mild, almost innocuous illness in the young person or the child. And then you get up either to the older person or to the very obese person, you can have a significant case fatality rate. Next slide. What are some of the diseases that we've eradicated by immunization? Smallpox, of course, one of the Edward Jenner was famous for that, using cowpox to show that it could produce immunity. And although I was still coming up in an era where we got smallpox immunization, it has really been eradicated from the world and is no longer necessary. Chickenpox or varicella, I mentioned that is one we've got a long way toward taking care of, and that is, I think, along with doing that, we're probably going to continue to see a dramatic drop in shingles, which is a particular problem for older individuals because of the pain and disability associated with a severe shingles attack. Polio, I mentioned also that is the one that we have been able to eradicate by immunization. Now, measles, we're going to talk a little bit more about that in a second because we're in the midst right now of an epidemic of measles in our country. We declared measles to be eradicated in 2020, but now through a variety of unfortunate circumstances, we are having an outbreak, which, as I'll show you in a second, has affected pretty much all parts of our country. So next slide. Excuse me. Go back there just one second. I mentioned the cervical carcinoma already. The hepatitis A and B, we pretty much knocked those out in folks that have been immunized, and rubella. Next slide. Now, we got some.
Sorry, I get advertising here. Sorry.
Okay. Now, the measles epidemic we're currently going, this is probably the most interesting and current thing that I could talk to you about a little bit. This has been a pretty big deal. Over 1,000 infections, really around, this has been increased to about 1,200 now. And you compare that with 285 cases in 2024. And they've also been about 10% of these have been hospitalized, and there have been 3 deaths. Cases have been reported. I was giving a regional take a look at Kansas and Missouri, Colorado, Oklahoma, and we have seen actually Nebraska now has cases. So in 36 or 37 of the jurisdictions, states and territories have really seen cases of this. And the reason more and more about this has been a decline in the percentage of our children who are being immunized. And this has been a hard one to understand because this vaccine has been so effective to get rid of this risk of measles. And not only is I think worldwide saved about 150 million lives, but and you take a look at lives, not only just the death, but the lives lost for the life of that individual, it is in the billions. How this seemed to occur was through the Mennonite community in Texas. And apparently, and this had a relationship to the Mexican Mennonite community. And as you may know, because we have a significant Amish presence in the Missouri area, that these religious sects have there's no definitive uh, prohibition of getting measles shots, but they may have somewhat of a tenuous relationship in which doctors have viewed as needed for serious things, but may not employ it as much for prevention, things like that. So again, we see that, and keeping in mind, as you see right there, at least 14 of the outbreaks, 3 or more related cases. It is airborne, it is highly contagious, and it's potentially severe. As you see, people think that they're it's not that bad, but as I say, there are deaths, and there have already been deaths, and it's particularly sad to see that in a child of a life lost. Prior to the vaccine, you can see right there 48,000 hospitalizations a year and 400 to 500 deaths each year. And then the vaccine came out at 63 and has been a huge success. The first dose is given at 12 to 5 months of age. There's a typo there. The second dose is given at 4 to 6 years of age. And this produces greater than 95% immunity. And one of the reasons we're seeing this epidemic occur in Texas, which is spread throughout much of the country, is that our percentage of children are necessary to be immune and receive the shots has been declining. And that's multifactorial, more than we can get into a presentation like this, but it's below 95%. And this allows this type of an epidemic to occur. And we're about sixfold in more cases than we were in 2024. Now, and anticipate that we will see 2,500 to 3,500 total cases by the end of the year if we continue to see the same rate of growth. So hopefully this will be a wake-up call to make sure that our children are getting immunized, and because we are in the midst of a real epidemic. Next slide. This just shows you our viral vaccine. And when we talk about chickenpox, varicella is the first one I have listed there. And the new improved shingles vaccine, I've indicated, I think, one, if we have a population growing up that never has varicella and chickenpox, then we may this is another one of the diseases that may really disappear over time. The interesting thing about what happens in chickenpox is we go through the illness, which is somewhat benign, but when the virus gets in our bloodstream, it then goes back and goes into our nervous system and gets into the neural collection part of our construction of our nerves, and we call the ganglia, and kind of sleeps there for 10, 15, or 20 years. And it kind of one word, it's neither alive or dead. It's just coexisting. It's certainly not dead, but it goes into a period of hibernation, is what we might think. And then as our immunity decays, then we'll have an outbreak of shingles, which mostly occurs in the plus 30 or 40-year-old individual, but will occasionally be in younger individuals. And it can be a real problem if it occurs in the immunocompromised or the cancer patient. But one thing I think of those of you that may not realize is to say we've got the varicella vaccine, which is part of the combo that we give to young children. But with the shingles vaccine has been one that's specifically designed for older individuals. And used to, we were mainly thinking that that shingles vaccine was going to protect, again, uh, folks that are in 50 plus age groups. And except for the shingles, we didn't really think there was much of anything that was going on. But I mentioned how these viruses can be there and they sleep in our nervous system, and we're not quite sure what they do. It is a couple of different reports have shown that the a real decline in the incidence of dementia, which has been around, like I say, around 20%, in individuals who have received the vaccine. So it may be that this is going to, you ought to keep an eye on this, because if this continues to be looked at and confirmed, we may try to really even more encourage than we are currently doing folks that are candidates for the shingles vaccine. And they've got a second generation shingles vaccine that is far better than the first one that's out there. So keep that in mind. That's new stuff in the past 60 days. Measles, of course, straightforward. We talked about that. Rubella, mumps, polio. RSV is an exciting new vaccine for children and adults. Obviously, it is of special note, but all these you recommend for all children before 8 months of age or entering the first RSV season. For high risk children, or those you see right there on the slide. And this has led to a real reduction in RSV and related hospitalizations. We also have been encouraging adults to get this vaccine because it is a significant cause of morbidity and mortality in individuals 60 plus. And I've certainly had mine, and not surprisingly, somebody that had a life in infectious disease. But they've seen a big reduction in RSV-related hospitalizations. So the proof in the pudding is this is a new vaccine that's rolled out, and the uptake has not been what everybody would like it. It's still only 30 to 50%, but maybe we'll be able to get there. Next one we see is influenza, changes yearly depending on the circulating strains. And then I mentioned already the human papillomavirus, cervical cancer prevention. Initial age is 9 to 14, females are 15 years or older, and the catch-up. Okay. And of course, our COVID vaccines. And the New England Journal recently put out an overview for COVID, seeing that the mortality is so high, what they are definitely with pushing hard on COVID vaccines if you're 65 or older, because that's where the mortality was. So you're seeing a real push on that. For those younger than 65, either some immunological problem or something like that. The other one, what I saw in my practice was very obese folks that BMIs of greater than 40. They also tended to have a very difficult time with this. So I think look at immunocompromised state and age are probably where we're going to be using this, and hopefully the viruses, we're going to get ones that are better and may have a more lasting immunity. Next slide. So this is what we're kind of leading to. It talked about the vaccines recommended for individuals 60 or greater. The zoster vaccine, which I think we've talked about, the RSV, the COVID with your boosters, is plus 65. The influenza, and if you're generally older than 65, with probably the high inoculum type influenza shots are preferred. The pneumovax, and that's one of the times that I'm showing you, it's a bacteria, not a virus. It prevents Streptococcus pneumoniae. A lot of the pharmacies have taken over vaccine administration. That's where I kind of go, which is a simple in and out. If you can get those through your healthcare provider, that's fine too, and no doubt about it. But keep in mind, if you are in this bracket that I'm showing you here, make sure you're up with all those. Next slide. We we organized and developed the first travel clinic in 1986 at Research Hospital, and it's been in continuous operation. Now you can see 14 and then 25, so almost 40 years. And this was to advise travelers, and because many of these are viral infections, yellow fever, smallpox, hepatitis A and B, Ebola, tick-borne encephalitis, rotavirus, dengue, and Japanese encephalitis. So if you're going to, if you're going to take travel, especially if you're going to more primitive locations or folks where these diseases are endemic, uh, the travel and immunization clinic could take care of you. Next slide. The other thing we don't realize is that not only can we prevent viral infections, but we really have a lot of medications that are good at treating viral infections. And I counted those up in around 91. 11 viruses can be, 91 medications, because many are for the same indication. 11 viruses can be treated, including HIV and Hep C particularly well. So HIV can be, we now are seeing continued dramatic improvements in which the science is going ahead of the political will. But we in areas where HIV is very common, we have tried to give prophylaxis, depending upon whether it's continual prophylaxis or after a sexual encounter. And yet the problem with this tracking folks has been difficult. And just really in the past couple of weeks, they've had some studies reported showing that with an IV preparation, it gives like 6 months of protection. And the problem is that the manufacture of this is expensive. And so we now have the tools, if we could have the political will and the financing, to make huge impacts in these areas where there are high risk by giving this Q 6 month and almost wiping out the epidemic. And that's a long way to come from our first conference that we had in HIV in the Kansas City area back in 1986. COVID, I think we've talked enough about that, but this continues to be a problem and it's not going away. Herpes simplex 1 and 2, we have very good medications for them, excellent medications. And going back to HIV, excellent medications besides the IV forms, that it's a completely controllable illness. For the HIV patients, I'll mention that now. My oldest patient is an 87-year-old lady, so who I treated for many, many years. Hepatitis B and C, good therapy for C, fairly good therapy for B, varicella zoster. Influenza, very good. C and V, reasonably good therapy. Smallpox and Ebola, we're able to use a monoclonal antibody. Next slide. This is, I wanted to show I bring you up to date because this has changed a little bit. We're known, of course, that women outlive men by about 6 years. And during the COVID epidemic, we had a drop of 2 years of life expectancy for both men and women, which is the higher drop that we've seen in a long, long time. Now that has come back up now where it's more like 76 for men and 81 for women. In Missouri, this was when I was researching this talk and some prior ones, in the mid-COVID epidemic, in a couple of years back there in 21, 22, there were more deaths than births in Missouri, and that impressed me. The COVID deaths in the USA at the time we put this together is about 1,200,000, 80% greater than age 60, as I mentioned. Next slide. Where do you try to find good sources of medical information? I mean, my areas of expertise were obviously in the diagnosis, treatment, and prevention of infections, primarily in adults, and with the expertise in developing a lot of the antibiotics, and that's what I brought to the table. The CDC undergoing some changes, I think, that are somewhat of a concern. So I really, there's a medical advisory committee for immunizations. I would pay a little bit more attention to them until this all shakes out. The WHO is a wonderful organization, and we relied on them a lot in our travel because they take a look at what's going on throughout the world. The CDC is still a great institution. Mayo Clinic, Cleveland Clinic, Johns Hopkins, these often will uh, have publications which are designed for the public, and they will go over for a variety of illnesses, cancers, and different things like that. But they're good sources of medical information. Local well-respected medical schools, UMKC, KU, and the medical letter. Next slide. So what we tried to do here is review a little bit about the structure of viruses and how they get into our bodies and reproduce. As you remember, they're little particles of ribonucleic acid or deoxyribonucleic acid surrounded by a protein coating, and very, very small, 150 to 200,000 on the uh, end of a pin. And then they can reproduce or they can be in a latent status, and they're extremely common, as I say, more common than the stars in the sky. We told you a little bit about viral epidemics of the 20th and 21st centuries. We told you a little bit about viral diseases that were eradicated by immunization. Reviewed recommendations for immunizations of patients greater than 60 and vaccines that are particularly useful for that group of patients. I reviewed this recent measles epidemic, which is continuing and showing some serious problems in our country because of the decline in the percentage of children that are immunized adequately, which is necessary to prevent the propagation of measles, and that you have to have enough unvaccinated folks around for the epidemic to continue. We've told you, reviewed a little bit about antiviral medications to let you know that for many illnesses, for viruses, we can not only prevent them with immunization, we can treat them highly effectively. So let's go ahead and right now, let's see if we have any questions.
Yeah, I have a question. Uh, since at the beginning of COVID, they were comparing the pandemic to the 1918 flu virus. So with the hindsight of 5 years, COVID behind us, how would you compare those two pandemics?
Well, I'd have to put on my epidemiologist hat. There were some differences. There were one thing that, as I mentioned, the COVID mortality was concentrated a great deal in older patients. The 1918 epidemic, that was one of the things where a great a number of the patients were younger, so there wasn't as much of a push to the plus 60s uh, as 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 you've seen with COVID. Uh, the modes of transmission pretty similar. Obviously, the respiratory method, you know, that was for both. The Of course, we didn't have any treatment available back then for influenza, and we had no vaccines for them. So we brought a lot more tools to the epidemic from what we were going through, and that has helped a lot. But I think everybody was touched by COVID because My one of my wife's physicians died from COVID. A radiologist at the hospital that I practiced at died from COVID. So I mean, and the both the it, one of the CEOs at one of the hospitals, his uh, mother died from COVID, and the father was seriously ill with it. So when we see folks that were in that age group, but I think in general there is a lot of similarity with the spread, them being both respiratory, that we have places like the NIH and CDC, so we have more tools to diagnose and to treat effectively. But they are different in how they and how they play out on individual segments of the population.
Thank you. And I have another last question. So, you listed how most of the vaccinations happened in young age. And is there ever need to revaccinate in older people? Because I was traveling to Europe a couple years ago and they had some outbreak. I forgot what it was. And my doctor suggested that they recheck if I still have immunity for the specific disease. I forgot what it was. And and I still had it, so I didn't need to be revaccinated. But are there ever instances people should, get vaccinated again for the childhood diseases?
Not usually. That's pretty unusual. Uh, that that we don't. I don't think we have any. If you want to ask our question, if later on off camera, or whatever, if you could get some information about which particular illnesses she or he was talking about, because a lot of times, usually what they're going to do is make a kind of objective. They'll draw an antibody, but that antibody will only be for a particular illness, measles, mumps, rubella.
Yes, it was one of those, and I honestly don't remember which one it was.
And so that's going to be the hard part is that uh because when you're doing something like that to check, you have to ask what is your exposure? For instance, we thought measles being eradicated, then it just as you got older, there probably was not a reason to uh or if you've got a natural infection, we know that produces lifetime immunity. I think if we ask a specific infection, I could try to take a look at that. Ordinarily, we don't say that we redo the like the polios and things like that, and we found that like polio is one of the ones that if people have had the polio uh, vaccine they don't need to be that doesn't need to be given 5, 10, 15, 20 years later because but you're seeing two things happen. One is you drive it out of the population, you're less likely to be exposed to it. Then the question is, are you having the durability of the immunity, or is it epidemiologically that the disease has gotten totally eradicated and therefore you don't have an exposure? She's got a pretty sophisticated question there. And as I say, if some way, if you want me to try to find a way later off camera, I could reach out to her or him to try to see if we take a look at a specific one. But ordinarily, that's why we broke it down at 60 about the immunizations that we recommend. But ordinarily, if you're in that gone through the childhood vaccines and gotten everything you need up until age 60, or unless you have special circumstances or immunosuppressed through cancer or other things like that, then you have to decide on a case by case basis. It's
Mhm.
a complicated question.
And then I just would like to say the vaccination protocol is a little bit different in Europe than it is here. People for tuberculosis haven't been vaccinated for very long time in United States, if I understand it correctly. But in my childhood, I was vaccinated for tuberculosis. And one time there was a big abroad how I tested positive for tuberculosis.
Sure.
And then friend of ours who is a doctor, he said, Magda, you will always test positive because you were vaccinated. You have to do a different type of test. So I just wanted to throw it out there. If people got ever vaccinated for tuberculosis, they have to have a different type of test for it.
Right, and usually that enthusiasm for BCG is kind of waned, and in our country, I think it was never widely used, but people have given it. Of course, that what that is an attenuated tubercle bacillus of Calmette-Guerin. So you're giving and inducing a attenuated infection to provide immunity against TB. We've had a lot of good things of being able to diagnose TB because now we can do blood tests and a variety of things and don't even have to do the skin test anymore. But no,
Mm-hmm.
I mean, this is always a very dynamic field. Even as we're seeing right now, that's a question to take a look at everything. Give
Yeah.
a that this is one of the most dynamic fields of infectious disease is the prevention and treatment of bacterial and viral infections and the
Yeah.
relationships of immunization.
Well, actually, I'm kind of glad I got vaccinated for tuberculosis. Uh, I don't know how long it lasts or whatever, but I like to travel and and there are still places with tuberculosis, so I'm glad I'm vaccinated.
That's absolutely true.
All right, those are all of my questions. Thank you so much, Dr. Smith, for being here with us, and thank you for your great presentation. Thank you.